Pyometra in buffaloes. First of all, I would like to introduce ourselves. The members include Shanagan number 3, Nanisha number 11, Kanashapon number 16, Vaseline number 32, and Rarinha number 34. We divide this presentation into 5 parts. Let's talk about sheep complaint and history taking first. This is a female swamp buffalo named Riam. She is 2 years old and her body condition score is 5 from 9. The owner said he saw cloudy discharge from Riam Wawa 4 days ago before we met. From history taking, the owner said that Riam is a heifer, but she is the only buffalo that didn't know the previous history and no age detections. For management, there is a mud pool inside the pen. They feed them with grass and store water and libidum, haven't been vaccinated before, and the last deworming was a month ago. Move to the physical examinations. We went to this farm twice. The first time was on October 19. On physical examinations, it was found to be normal except body cardia and has parts in her vulva. The second time was on October 25th. All vital signs were normal and no parts was found. So the problem list of Riam is part at vulva. Parts at vulva can occur from 3 locations, including uterus, vagina, and vulva. From uterus, it can cause by endometritis, metritis, and pyometra. From vagina, it can cause by bruised vaginal mucosa, necrotic vaginitis, and abscess. And from vulva, it can be abscess. Our diagnostic plans are blood collection to evaluate Riam's health status, rectal palpations, use a vaginal speculum to access the vaginal area, and transrectal ultrasound to examine the reproductive system.
From blood analysis, complete blood count or CBC result was found high eosinophil or eosinophilia. Increased mean corpuscular volume or MCV interpreted to macrocytic. Moreover, it was slightly increased plasma protein. In blood chemistry, alanine aminotransferase or ALT and aspartate transaminase or AST were increased, even though blood urea nitrogen or BUN was decreased. We interpret blood analysis result that eosinophilia caused by parasite infestation, hypersensitivity, and neoplasia. Macrocytic form vitamin B12 and folate deficiency or red blood cell agglutination that can cause a differential increase in MCV. Slightly increased plasma protein may form dehydration or chronic inflammation. From clinical side, we can rule out hypersensitivity, also in neoplasia because we don't find any sign that related to be neoplasia. In addition, Riam is a young buffalo and found nothing in physical examination. We rule out vitamin B12 and folate deficiency from Riam didn't have anemia. Increased ALT and AST may causes by hepatic injury, parasitic infestation, metritis, neoplasia, and T-cell disease. In the same way, we rule out neoplasia and T-cell disease from have nothing clinical sign related to BDS, and low BUN from low protein intake and hepatic insufficiency. In rectal palpation was found uterine enlargement, and vaginal speculum was found pus in vagina.
For ultrasound in first day show small follicle at left ovary, unlike ovary was found corpus luteum estimated size 1 cm. Uterus was found hyperechoic particle at lumen, and uterine wall was thicker. Moreover, in vagina was also found hyperechoic particle. For ultrasound at second day show left and right ovary look like the first day and decreased hyperechoic area at lumen of uterus and vagina. Next is device assessment. From history, physical examination, and use of vaginal speculum, We can rule out bruised vaginal mucosa, necrotic vaginitis, and abscess because we didn't find trauma, laceration, abscess, or necrotic tissue at vagina. From ultrasound, we found hyperechoic particle abdomen, but we didn't find abnormal mucosa of vagina. In addition, we can rule out abscess at vulva because we didn't find abnormal lesion. Next topic is diagnosis and treatment. From the ultrasound, tentative diagnosis in this case is Pyometra. For treatment, we injected PGF2 alpha 25 mg via intramuscular for stimulated corpus luteum breakdown, and we injected long-acting penicillin G dose 20,000 IU per kilogram via intramuscular. Moreover, we did vaginal flushing that include oxytetracycline dilute with normal saline 1:9 ratio for 70 ml. For management adjustment, the owner should separate them from other buffalo. Follow-up in October 28. The buffalo was alert and responsive. No purulent discharge from vagina and no extacite, including mucus from vagina. Furthermore, the owner injected penicillin G followed by veterinarian suggestion.
The next is discussion. First, we will talk about the buffalo ether cycle. The buffalo ether cycle is unclear and hard to detect estrus because behavior that are likely to the cattle. Even so, the buffalo estrus cycle is similar to cattle estrus cycle, but in buffalo, they could have 4 follicular waves. In previously ultrasound image, we found a small follicle at left ovary and corpus luteum at right ovary. It could be middle or late of estrus cycle. In this period, mean buffalo is not in estrus, the cervix is closed, so the PGF2 alpha should inject for luteolysis and make the buffalo in estrus. If the buffalo is in the estrus, cervix will open and pus will drain. The endometritis and pyometra can cause by bacterial infection. In estrus period, it makes open cervix, have suitable uterine environments such as more gland and mucus, and increase the immune response. When bacterial infection in uterus may be from dirty environment or AI technique, it can cause endometritis and it will activate the innate immune response. Then white blood cells accumulate within uterus and vaginal discharge and become to pyometra and purulent exudate. The most common pathogen that found in pyometra is divided to gram-negative and positive bacteria. Gram-negative bacteria such as E. coli, Fusobacterium nicoforum, Pivotella, and gram-positive bacteria such as Streptococcus, Bacillus licheniformis, Acanobacterium pyogenes. The treatment of endometritis and pyometra. Pyometra usually have corpus luteum because it doesn't have PGF2 alpha for luteolysis, so it can inject PGF2 alpha for luteolysis and wait for estrus period. If it is in the estrus, cervix will open and pus will drain. The sample drug of luteolysis is utilized 25 mg. Moreover, it can give the systemic antibiotic for 3 to 5 days to control the bacterial infection. The sample of antibiotic drug are oxytetracycline 10 to 15 mg per kilogram, penicillin G 20,000 IU per kilogram, safety offer 2.2 mg per kilogram.
We also recommend uterine infection with antibiotic in case of endometritis and pyometra for elimination pathogenic bacteria in uterus. Antibiotic drug that we recommend are broad spectrum, including oxytetracycline 0.5 to 5 gram Q24 hours or every 2 days, cefalparin 500 mg once, penicillin G 10 million IU Q24 hours, or gentamicin 250 mg in normal saline for 6 hours. Uterine flushing is recommended for heavy purulent exudate case that will be decreased antibiotic potency. 0.05% povidone iodine with normal saline are recommended to use. Monitoring after treatments. Vital sign and total cell count are recommended to recheck. Moreover, ultrasonography or transrectal after 3 to 5 days of PGF-2 injection is recommended to do for STAT detection because PGF-2 will eliminate squamous luteum, so the buffalo should return to estrus. And 1 week after treatment, we can recheck purulent accumulation in vagina and uterus again. The complication that can occur after endometritis and pyometra is the decreased reproductive performance, including low fertility and increased number of cervical conception because uterus and ovaries are damaged from infection, inflammation, and adhesion. From blood profile result, we found other problems that can be involved are parasite infestation and hepatic injury because of eosinophilia and high ALT and AST condition. For the plans for this case, we collect purulent exudate from vagina for bacterial culture and drug sensitivity for case of no response treatment with antibiotic drug previously. And for blood profile result with health eosinophilia and high ALT and AST condition, so we suspect parasite infestation plus hepatic injury. So we recommend to correct PC for fecal examination to confirm. Moreover, we recommend to do ultrasonography with transrectal for STAT status checking because if the buffalo is in the STAT stage, her cervix will be open and we can correct purulent exudate from her uterus for bacterial culture and drug sensitivity. Thank you.